Oh, god damn that music every time. What's going on, guys? And welcome to a very energetic episode 2 of Burying Fake News. Top of the show, I'd like to give a big thank you to everybody who took their time out last week and downloaded episode 1, and to all those who gave some feedback. Amazing. Really appreciate it. We've taken on board and we're learning as we're doing. For those who are new, however, this is Burying Fake News, the show dedicated to burying the bullshit, the ballyhoo news stories that shit up your social media. My name's Lewis, and I'm the soon-to-be Dr. G. And to join me as ever on this quest, you can hear her tittering away from the sedentary position. The illustrious, the one, the only, La Jefa, interpreter, showstopper, my carer, and often all-round good egg. The illustrious Mariella. Welcome to the show.
Hi.
Come on again. I gave you such a good build.
Sorry. Hi, guys. Thank you so much for tuning in again.
Did you leave your microphone on mute again?
No, it's on.
All this time we try and do a good show and you leave your microphone on mute, and then sometimes we're sat down, I'm just trying to watch something and you're talking something, I wish you'd have a mute.
Oh, that's terrible.
Today, we have a guest on from the NHS, a biomedical scientist. Today, we're also going to be talking about Judy Mikovits.
The interview was so enlightening. I hope you guys enjoy it as much as we enjoyed interviewing our guest.
I thought it was all right. I'm just kidding. No, it was really good. And,
oh, goodness.
Definitely got that to look forward to. It was good. And what I'll also say at the top of the show whilst we're doing this introduction is, if you listen to podcasts regularly, if you are someone who hasn't just listened to it because I've done it, but you actually are a regular listener of other podcasts, and there's someone that you like a lot, or a group that you like a lot, and they're an independent, they're not pushed by a company or corporation, please go and support them. If that means £3 a month on Patreon, if that means buying their merchandise, whoever it is and whatever they do, go and support them, because I'll tell you now, it is not easy. Recording's easy, but to sit and talk to my missus, I do that convincingly most days. But to actually get it out edited, that takes so many hours. And then to go and get it onto a host and then generate the feeds to go and share it with everybody, it takes time, and it really does take a lot of money. And to do it free on a low dime is tough. So if you do have independent podcasters that you listen to, I implore you, go and support them. It's made me really reevaluate my approach, especially in Britain. In America, that hyper-capitalistic approach to everything, it's more like, yeah, I'll just buy that shit, yeah, I'll go blah blah. As Brits, we're not really that way inclined to part with our money, and sometimes that's for the good because we're less likely to get ripped off, I hope, but it's also bad for those British kind of people who are really trying to get out there and get their podcasts out there. So I do implore you, go and support them.
Yeah, I was very surprised at how much effort goes into editing and actually, putting out an episode, so I agree. So, should we talk about Judy?
Judy Mikovits.
Absolutely disgraced and discredited scientist.
Disgraced and discredited Dr. Judy. Who gives a shit? I got some deja vu. Have we just been speaking about her for 20 minutes?
I don't know. I think I feel it too.
So, this is someone who's been very key in arming the morons with knowledge that, well, I use the term knowledge loosely, faux knowledge if you like. This is someone who started their career in the 1980s with a BA degree from the University of Virginia. Following that, she actually worked at Upjohn Pharmaceuticals in Michigan from about 86 to 87. She was then basically fired for a dispute with the bovine, what we call BGH, bovine growth hormone, some product. So she's straight off the bat, she's bloody useless. Getting fired, she thought, what next? And then she went to do her PhD at the George Washington University, and she actually did a PhD in the negative regulation of HIV expression in monocytes, which I think personally is really cool, because when she was doing her PhD...
Right at the height of the pandemic too.
Yeah, absolutely. HIV was huge in the mid-80s, and she's doing a PhD on it. I think that's a really cool time, and I wouldn't say I'm envious, but I mean, that's quite a privileged position for her to be in with her work with HIV, and we'll come back to that later. So then mid-2000s, she ends up meeting Silverman, not Dr. Silverman from T2, but Robert Silverman of XMRV Research, which is xenotropic murine leukemia virus, related virus. And Harvey Whittemore, at the time, huge, was having a big paddy, if you like, about the lack of answers for his wife.
Mm-hmm.
Oh yeah, oh god, it was huge. They actually, her and Silverman got together. They got some positive data, and I use the word positive in quotation marks because they published it in Science, I believe.
Wow.
Yeah, it was groundbreaking. It was a blockbuster, as they say in Big Pharma. And then following that, following that publication, the whole field was swamped with reports of negative data. Nobody could replicate what they had done.
Oh,
No,
wow.
yeah, it was the same guy who said they'd achieved cold fusion in a test tube or whatever. No one could copy it. And like the guy
Wow.
who said we achieved cold fusion in a test tube, the Silverman gave the same answer, kind of, well, you won't be able to replicate our conditions. That's what he said initially. And then
No, but that's one of the fundamentals of science, isn't it?
oh god, yeah, reproducibility. But I think eventually he said, oh, well, we had lab contamination despite our best efforts to avoid it. So what he was saying is, we still saw this data, we didn't make it up, but it may have been from somewhere else.
Oh.
Lies. And lies. And this is before we even get into anti-vaxxer.
Oh, gosh.
Subsequently, yeah, following this, I mean, if you write a bit of bullshit in a paper that few people read and it's one of your yields isn't as good as the others, or you get a higher percentage than you actually did, and postdocs will lie. The pressure that they're put under, and PhDs too, the pressure that they're put under from their supervisors, especially in America, can be absolutely phenomenal in a publish or perish world. And that's why I believe that this, you have to publish to have your job, is bullshit. But moving on from that, we can talk about that another day. That's kind of why this happens. And small lies can come or go, and we're kind of used to them in science to some degree, providing the whole story makes sense. They wrote the Bible here.
Yeah, it sounds like scientific misconduct after scientific misconduct.
If this person worked in my building, I'd have slapped them. I would have really kicked off. We
Absolutely.
as scientists work so hard. Yeah, we as scientists, we pride ourselves on the truth. Personal truth, historical truth, fundamental truth, scientific truth. And that's the principles that drive science. So fuck you and
Of
fuck your
course.
payday.
And you work so many years and you study for so many years on working on credibility, right? And for somebody to come along and all of a sudden really shatter that is devastating.
I will just say that science paper did go on to get retracted, as you can imagine.
Well, thank goodness for that. But I guess the damage is still done, isn't it? Especially, I guess out in society, it's much harder to understand that something all of a sudden is deemed not true or has shown insufficient evidence for it. So that's, the downside to that.
Disgusting for profit. And when she then later on, a couple of years later, came out as an anti-vaxxer, that was also money driven. And we're going to do a whole episode on anti-vaxxers and where that stems from and why that's bullshit too. But we don't want to get off topic. We'll just say that she tried to purport it.
Oh gosh.
Back when that was a thing to purport, right? Oh gosh, indeed. Moving on from that to current day, we have COVID-19. And then she took part in a film which I think is now completely removed off the internet. It's not on YouTube and it's not on Vimeo, it's not on Facebook, because it's just, well, it's egregious lies. And I don't want to give the title of what this film is called, but if you go and search, Dr. Judy Who Gives a Shit and her movie, you'll find it. It's a half-hour documentary of deceit.
Oh wow. And I thought my classics were dramatic.
Oh, I'm just getting started. You know what I do have? I'm not going to give the name of it away, but I do have some excerpts from the documentary. Do you want to hear what she actually said?
Oh, please, let's hear it.
Well, so the documentary opens with her saying that she was held in jail with no charges, and that's called being arrested. Anyone who's ever been arrested will know you can spend a night with a sheriff and, that doesn't matter. That's not going to prison without... That's jail. That's how the world works, dickhead. So the interview goes on to then ask her about being arrested, and she sort of moans that she was held in jail with no charges. We've kind of just covered. Then Mikovits goes on to say that the Department of Health and Human Services, the HHS, colluded and destroyed her reputation with, with working with the FBI and Anthony Fauci.
Oh my gosh, the Anthony Fauci we see now?
The same guy, believe it or not, is not only working to save lives, but also a mad FBI player, huge backballer in the Rockefeller Institute.
He might as well be the head of the Illuminati too.
These are quotes, by the way. I'm not paraphrasing, but she goes on to say, Fauci, he, directed the cover-up, and in fact, everybody else was paid off, and paid off big times. Millions and millions of dollars in funding from Anthony Fauci, and National Institute of Allergy and Infectious Diseases. These investigators that committed fraud continue to this day to be paid big time by the National Institute of Allergy and Infectious Diseases.
Oh my goodness.
So she's saying that it's okay for her to be paid millions to perpetuate lies about vaccines and autism and coronavirus. But when someone else does it, when someone does it against her, it's clearly for money and nothing else.
Well, it takes one to know one, right?
Well, it goes back to that tweet of the week last week where they said you have to consider that, I alone solved something that experts have never known is less likely than experts know something I don't. If you are one person, even with your biochemistry PhD, and everyone around you is telling you you're wrong, right?
Mm-hmm.
Everybody. And this isn't like a paradigm shift of an idea. This is just you looking for money and using your degree for notoriety.
Yeah, absolutely. And I think, you said earlier, that she's the one not just spewing this, but it kind of gives the people who spread this misinformation a bit more of a platform, right? It's they can say there's a scientist who says there, and this is Dr. Judy, and this is when it becomes harder to, or you get into more complex arguments about, her work being discredited or evidence that has been shown that has showed the contrary and stuff like that. I think it's so much harder to just straight up say, you know what, no.
She also goes on to say, quote, "It started really when I was 25 years old." Is this Tweets of the Week? Are we doing this section already?
Could be,
She
right?
said, it's play the music. She said, "When I was 25 years old, I was part of the team that isolated HIV from saliva and blood of the patients from France, where they originally isolated the virus. Fauci holds up the publication of the paper for several months. Basically, Fauci is the reason why it didn't get published, and Gallo writes his own paper, and this is another guy, and he takes all the credit, and there's patents involved, so basically, again, alluding to the fact that there was money and she got screwed out of money, and that the delay of confirmation literally led to the spreading the virus around, killing millions." I will stress this, at the time of HIV's discovery, Mikovits was a fucking lab technician. She was not doing a PhD and she was not doing research. She was supporting a role somewhere else independent, yet to receive her PhD. There's no evidence that she was part of the team that first isolated this. And in her first published paper where she co-authored it, it was 2 years after the science paper that there was 4 landmark papers that were linked to HIV, then called HTLV3 or whatever by Gallo's lab. 3 years after Gallo's lab.
Wow.
And then Russetti's paper is the other person he talks about very briefly. That was actually in '85. There's no evidence that says that he held up that publication or led to the death of millions. That's just dramatic bullshit. By the way, the interviewer then goes on to say, if we activate, I might just fucking fact check everything she says. Yeah, the interviewer says, if we activate mandatory vaccines globally, I imagine these people stand to make hundreds of billions of dollars that own the vaccines, which is what an interviewer would probably question, right?
Mm-hmm.
But remember, this interviewer is also being paid by the same people who are paying this fucking idiot. She said in reply to that question, and they'll kill millions, as they already have with their vaccines. There's no vaccine currently on the schedule for any RNA virus that works.
Oh my gosh.
This is tweet of the week, isn't it?
Yeah,
We're in the wrong segment,
basically.
Sweetie. So just to clarify, vaccines have not, nor never have, killed millions. They've saved millions of lives. Fuck. And there are many vaccines that work against RNA viruses.
And I think, this whole argument about money being a factor, everybody knows big pharma doesn't do things for free. The pharmaceutical sector is one of the most powerful, most, rich sectors there are worldwide. So I'm not surprised that, there's money involved in, these pharmaceutical companies wanting to make some, but that doesn't discredit the work, that scientists have put into creating these vaccines or these treatments too.
All right, well, yes, maybe I overlooked that. Maybe I forget my audience sometimes. Apologies. Yes, absolutely. But for me, the most egregious part of that, quote, there is no vaccine currently on schedule for any RNA virus that works.
Yeah, that's a blatant lie, isn't it?
Let me ask you something. How many people have died of measles, mumps, rubella, yellow fever, do you know? Rabies. How many people do you know
Yeah,
with
no,
rabies?
none.
None. You know why? Because we have a vaccine that stops that.
Absolutely.
The interviewer then goes on to say, so I have to ask you, are you anti-vaccine? And then in one sentence she says, no, yes, I am. She goes, oh, absolutely not. And vaccine is immune therapy, and I'm all about immune therapy. We just need, quote, an immediate moratorium. What the?
Oh, that's kind of crazy.
So yeah, in one sentence, she's saying, no, I'm not anti-vaxxer. We need to stop all vaccines immediately. None of them work. I've just given you rabies, yellow fever, mumps, rubella. These are all examples of RNA viruses that are proven vaccines. So fuck you, Mikovits, and fuck anyone who looks like you, and fuck anyone who's on your side, idiot. And if you live in Michigan or wherever she resides, and you see her in Aldi, and you see her in the shops in Kroger or wherever else is you shop, sweetie, North American shops, help me out. Target, where else? Come on.
Target, a Macy's, and Nordstrom.
If you see her in any of those, you just go and slap the piss out of her mouth. Don't say a word, just bang! I've hit people for a lot less, and they should be hit, and rightly so, because they are spouting dangerous mistruths, unguided lies that give rise to the crap that we see online every day.
And in addition, I think she discredits everybody who has worked really hard and has given their lives, work and time to
very disrespectful
to doing all this, right? I mean, with one sentence, she's basically saying all of that work, the work that has been done for centuries, is worth nothing.
Absolutely. She also went on to say that she basically tried to link an influenza, like what you'd have your seasonal flu vaccine. She tried to link the flu vaccine to a dog coronavirus.
Oh yeah, she said something like, basically one of the tweet of the weeks last time, basically saying that we've seen an enhanced flu, right? That the COVID-19 that we're seeing now is
yes, that's it. Yes,
just from a flu vaccine that we put out, I think 2013, 2015. Absolutely insane. Like there is no evidence to ever suggest this, and to activate a flu from a vaccine is, at least that I know of, it doesn't work like that.
And then just finally, this is what's really important here. One of the main kind of talking points from this bullshit article was that she said, and I'm going to quote here because I don't want to misrepresent her, quote, wearing the mask literally, this is so tweet of the week, wearing the mask literally activates your own virus. You're getting sick from your own reactivated coronavirus expressions. And if it happens to be SARS-CoV-2, COVID-19, then you've got a big problem.
So basically she's blaming people for infecting themselves.
It's your fault you're sick. You wore a mask once, now look at you. I don't think it's clear what she means by coronavirus expressions. And wearing a mask will not activate anything or make you ill.
Maybe she's kind of thinking along the lines of, you've had a flu, you should change your toothbrush, sort of thing. But that's...
I don't know. I don't know what she means, and I don't want to talk about it any longer. Fuck her. She's wrong. Anyone who says 5G causes corona or quotes Judy Mikovits on the fact, oh, she's got a PhD. She's a disgraced cretin. She took a payoff to lie, nothing more, nothing less. She can't be trusted, and she never will be trusted, and she'll never have a publication to her name again. Fuck her, and fuck anyone who looks like her, and fuck anyone who's on her side. And if you're a scientist and you know this person, you live close to this person, or they try and come to you for a job, you need to slap them down. And boy, howdy, should you slap them down for all the reasons we've just said. If you really believe in what you study, in what you spent so long of your life dedicating yourself to scientific truth, then you will do the world a favour and slap this person down and say, you've disqualified yourself. You can go and be Mother Teresa for all I fucking care, but you will never, ever take rightful place in science again.
Absolutely, and she has officially been discredited as a scientist, and I'm sure Science, like the journal, has actually, taken out articles fact-checking her and basically saying everything she says is a lie. So she has no standing as a scientist anymore.
Should we talk to a real scientist? Jesus, should we get this out of the way and talk to a real scientist?
Absolutely. How exciting. It'd be nice, refreshing after talking about Judy.
Well, and with that piece of business wrapped up, we're going to move on to our interview that we teased it last week, and here we are this week. You want to hear it? Here it is. Good friend of mine, known for a while. He works for the NHS, and he's a biomedical scientist, and he's going to come and answer a few of our questions that we have and just talk a little bit more about what's going on in the world, especially with him being on the front line. So, Lyndon, welcome to the show.
You all right, Gooch? Good to be here.
No, thank you for coming. We appreciate your time.
Yeah, thank you so much.
Yes, no problem.
Just for the fine folks who have taken their time to download and have got this far through the show, who are you a little bit, and what do you do?
So my name is Lyndon, and I'm a biomedical scientist. So I'm registered with the Healthcare Professionals Council, and that means I'm allowed to work in labs and hospitals and produce results that then doctors use to make their clinical decisions based upon the results we produce in the lab. So the lab that I work in is the blood sciences lab. So I deal with things sort of like full blood counts, coagulation, and I work in blood bank as well, so blood transfusions, then also biochemistry and immunology as well.
That's so insane. Could I just ask him briefly? Could you tell us a bit more about what you studied?
So my degree is in biomedical science. So that covered sort of all aspects of what we do in the lab, mainly things like hematology, blood transfusion, biochemistry, genetics, virology, general microbiology, histology, cytopathology.
All the G's.
Wow, that's so much.
Yeah. So most of the stuff I don't really need to use day to day, apart from what I learned in hematology, transfusion, biochemistry, and immunology.
All the G's. You have to be
Yeah,
qualified for all the G's. Lyndon the G.
Yeah, I can see that.
Yeah, there's a few ways of getting into it. Let's say, like, some of my colleagues have got biochemistry degrees, and I think a couple of others have got like sort of human physiology degrees.
Oh.
But again, you will have to go through that process of getting registered with the Healthcare Professionals Council. So for me, that's quite straightforward, having a biomedical science degree. But if you've got a different degree, say a biochemistry degree, there'll be other modules you'll have to do. So you'll have to do a little bit of study in your own time before you can then go to them and say, this is my qualifications, I know what I'm doing. And they'll say, yes, you do.
And speaking of knowing what you're doing, that's exactly why you're here. So straight off the bat, how has your day-to-day life, particularly in work and what you see, how has that changed since lockdown, or during lockdown rather?
So the most strange thing that people are like sort of surprised to hear to start with is initially for us in the blood sciences lab, the workload just plummeted.
Oh wow!
Because people stopped coming to hospital. All the GPs closed. Hospitals were only admitting people who are desperately need to be there. Like then people are sort of generally being afraid, so staying away from A&E, not going to A&E unless they really, really need to be there. And obviously everything pre-planned, all the pre-planned procedures and that all just shut down to start with. So, but then after that, we sort of like some of the staff started getting a little bit sick. So we had some of the staff would be off either self-isolating or ill. Then sort of later on into it, fairly early on, we had staff being redeployed. So like there's a few of my colleagues have backgrounds in virology, so they went straight over to the virology lab.
Absolutely. So let me just quickly roll back there to what you were saying. So initially you had very little going on, And then when people started getting ill, so as people started getting ill, and they went off self-isolating, what can you talk about what the protocol was if you are an NHS staff member and you're ill? What is the procedure? Do you get a test, or do you just presume you've got it?
Up until very recently, it was if you've got symptoms, you'd stay off work for 7 days or until the symptoms have finished. Or if someone that you live with gets symptoms, you'd stay off work for 14 days. But then if you then develop symptoms, it'd be 7 days from then. That's what we've been operating on for the longest time now. So we've only just started getting staff who were able to get tested. So that was the process we're working under initially. But sort of to start with, things kept changing very fast, like all the procedures we had to follow. Because obviously no one knew what we were dealing with. No one knew exactly how contagious it could be, what the risks were to us in the lab. So there was a period of sort of people going off ill and like, oh, I was working with them yesterday. What does that mean? Do I have to go off ill?
Yeah, absolutely. And the uncertainty, especially early on. And in terms of your opinion, I'm going to roll back now to early January kind of period. The numbers that were coming out of China, that obviously we now know were wrong, didn't indicate, at least to my understanding, that we could really have an issue here. It was only when we realised how bad it really was when the numbers started becoming legitimate. Would you say you was in the same boat? Were you following it that early at all?
Like in January, we were aware of it. Like we'd heard some reports come out. I remember chatting with my colleagues in the tea room at work, thinking, "Oh, this sounds a bit interesting. What's going on there?" But I remember like way back in January. So my girlfriend, she'd actually booked a holiday, and she was supposed to be going to China in April. And I think it was a bit after January when it all started kicking off. And she was like, "Oh, do you think I'll still be able to go on my holiday?" And I was like, "Yeah, probably would have blown over by then. Like, I don't think it's going to be that big of an issue." I was like, "April, it's a few months away. It will have blown over by April." Which obviously we know that was
Oh no.
it didn't turn out that way. But initially, yeah, we were hearing stuff coming out of China, and we're thinking, "Oh, it's interesting, but it doesn't sound that bad."
Yeah, I was guilty of that too. I just thought that it's these numbers just don't concern me, and now all of a sudden we've got so many people who sadly aren't with us who should be.
I found one article or blog post. I was reading it in the tea room at work, and it's like inside the Chinese hospital where bodies are piling up on the floor and patients are just dropping dead everywhere. And I was like, "Oh, that sounds like a load of bullshit." Like, I was like, that doesn't correlate with what else I've been reading. So that probably was a bit of an extreme picture of it, but I think that was the first like indicator that it could potentially be worse than, oh, just a few people have got sick.
I think like at least in my case, what kind of made me think like, oh, it shouldn't be too bad is that we've had similar experiences with like SARS and MERS, where we saw it emerge somewhere, and then we're like, it's all right, it was kind of a big deal for a little bit, and then it just kind of disappeared, and I guess people kind of thought it would be the same
Yeah, I'd say I was
thing,
kind of
right?
probably expecting something similar. So I do remember reading about MERS, and it was quite bad for a while, but it just sort of fizzled out. And I mean, obviously, it was terrible for the people it affected, but it stayed really small and localized.
So in general now, how is the NHS holding up? How is it coping?
Well, I'd say yeah, coping better than what it could have been or what some people expected. Like there were probably some things that could have been done better, some things that have been done okay, but again, from my perspective in the lab, it's been all right. So we did have some. Yeah, we had FFP3 masks, which are those are the ones that seal against your face, and that they actually do protect you from catching it. We think anyway. But we had a box of those. We just have it in the lab, and we used that entire box in about a week, and then we still haven't had any more. So I think the mask we were supposed to
Oh
get,
wow.
they went to the ward.
I don't know how much your employer is going to want us to air of this.
Yeah. So, but I think I think it's we're a low priority area at the minute because what we have had delivered after it was probably a good 4 to 6 weeks for us to between getting it delivered and installed. We've got a big microbiological safety cabinet now, so we're told as long as we do everything in that, then we should be completely fine. Like the hospital where I work was in quite a good position in that the trust was upgrading the ventilators. So we'd had the new ventilators delivered, and they'd been tested, and I think they just finished testing them and saying, "Yep, these ventilators are good. They work. We're ready to start using them." And they were gonna, whoever the old contract was with, they were going to come and pick up the old ventilators and take them away. But somebody said, "No, don't take them away," and that they wouldn't let the guy take them away. So then we ended up with twice as many ventilators as what we should have had. So that's worked out quite well.
Not a bad thing.
Yeah, I mean, sorry, my impression, especially as an outsider, reading about the UK situation, was that the UK was hit quite devastatingly so with all this. The death toll is high compared to the rest of the world and what's still unfolding. But one of the main goals from your government appeared to be, not overwhelming the NHS, and I think at least that goal was actually handled pretty well. Like, it never seemed like there was ever a report like the ones that we saw coming out of Spain or Italy where hospitals, were so overburdened with people that people were dying in the hallways or, going home to die or something like that. So I think at least the impression I got was that the NHS actually managed to hold, put up a fight. And that's quite a victory in itself.
Yeah, I'd say that's definitely the case in the hospital I work in, where it's been handled quite well. I don't think we've ever had any point where it's been, we're getting overwhelmed, we can't handle it, patients are going to die when they could be treated. So I don't think that situation's played out at all in the hospital I work in. I think that probably has been the case somewhere in London, probably. Like, there's probably been a couple of places in London when they got hit quite badly, where they probably did just about reach their maximum capacity. But again, things like opening up the Nightingale hospitals, and I think the key indicator there has been they've not really been utilised. Like, the one in London stayed in its first stage. I think they could have scaled it up to 4,000 beds, but I don't think it ever got more than 500 beds off the top of my head. So that shows that, yeah, the NHS wasn't getting anywhere near capacity.
That's good, though. That's what we want.
Yeah, it's been all right. I mean, it could have been better. It has been stressful at times, and there has been some learning to do and some adapting. But it's not been as bad as it could have been. Because there was a point where we thought, "Crap, this is going to get really bad," and it didn't turn out to be as bad as how it could have gone.
So, in terms of treatment, then, what are your thoughts on the current treatment and the new treatments that are being explored?
So I want to talk about one treatment that I've had some sort of involvement in, or some sort of knowledge of, that I think a lot of people are probably not so much aware of, and that's the convalescent plasma therapy.
Ooh.
For the fine folk who don't have all the ology degrees, what does that mean in
So,
in
so to break it down, so the word convalescent, that means it comes from the term like recovery. So, like, if you're convalescing, that's the same as like recuperating and recovering. So convalescent it means like recovering or recovered. And then the plasma therapy comes from that being blood plasma. So the idea is you take blood plasma from people who've recovered and then transfuse it into people who are critically ill, in the hope that could help them fight off the virus.
Is this have to do with the antibody and those treatments?
Yes. So the blood plasma, that's the liquid that the red blood cells float in. So you've got red blood cells going around in your circulation, but the red blood cells, they're floating in this liquid that we call plasma. So the plasma it's water, but it has proteins, sugars, vitamins, minerals, basically everything your body needs is all just dissolved in it. But some of the protein that's dissolved in the plasma, that protein's antibodies. So that's where the antibodies are. So the idea is you take someone who's recovered from COVID-19, who has produced antibodies, so they've mounted an immune response, cleared the infection, so they've got a certain level of antibodies in their system. So you take some plasma from them and then transfuse that plasma into someone who's, at this stage, it'll be someone who's critically ill with COVID-19, and in the hope that the antibodies that they've received in that plasma can then help them deal with the infection they've got. So it wouldn't give them any active immunity. It'd be what we call passive immunity. So the antibodies, they don't stick around in your system for all that long. And we're not exactly sure at this point exactly how long they'd stick around. But the hope is it'll be long enough for them to make some sort of difference.
I'd have thought 4 weeks would be.
Yes. So at this point they're trying to collect it from people who are 2 weeks recovered, because they don't want to leave it too long after they've recovered for antibody levels to drop. But obviously for each
I get
person,
it.
it's going to be different levels for different people. Like say some people could produce antibodies and have a level 100 times higher than some other people. So at this stage, the NHS Blood and Transplant, they're currently doing a trial. So at this point, they're trying to recruit donors, and they're testing all these people, and they're doing what's called antibody titrations. So that'll tell them how much of each antibody each person has in their plasma.
Is that done with a massive piece of glassware, drip one drop at a time?
Well, that is the original technique. I'd imagine there's probably some sort of automated process now.
So could I ask, I mean, has this been done before? Is there evidence that this works?
Yes. Well, it's a technique that's been used going back many decades, if not possibly about 100 years. It's a treatment that's not really used ever, because usually it's much better to develop a drug, so you can develop a drug or you can develop a vaccine. Those will be much more effective in the long term. So developing a vaccine can potentially eradicate an illness, or developing a drug that can treat it. It's much more easy to mass produce, and it's much more like easy to control the effects. You can control dosage. You can produce like a standardized drug. Whereas the reason they're looking at the convalescent plasma now is because you can do it quickly. Like, we already have the infrastructure for people to donate plasma and to transfuse plasma into patients. We already do that for like patients who have got coagulation disorders. So where their blood doesn't clot properly, you take plasma from someone who has healthy blood, who their blood clots properly, and then that'll give them the clotting proteins they need to make their blood clot properly. It's a similar process to that. Instead of the proteins they need for the coagulation, it's the antibodies they need to fight the virus. So like it can potentially be within the next couple of months, this could be rolled out as an actual treatment rather than a trial. So yeah. I mean, I say it's not going to be as good as developing a drug, or it's not going to be as good as developing a vaccine, but it's going to be out ready to roll out probably in a few weeks if the trials all go well.
Wow.
Yeah, it's a real life plaster just to try and fix us up to buy time.
Yeah, so I think they're already using it for compassionate use at this point as well. So patients who are critically in intensive care, I think they're already receiving convalescent plasma in a compassionate use case.
Yeah, what are you going to do? Kill them?
Yeah, exactly.
That's really cool stuff. So just coming back to it's not as good as a vaccine. We know that, and it won't be as good as a small molecule therapeutic.
But if it tips the scales of survival, that's great. I mean, that's something, right?
Oh god.
Oh yeah.
It's definitely something. Yeah, it's definitely something. What I was just going to ask you is, you're familiar with the process of drug development as well as I am, and what goes into that. What are you making of these, I don't want to say ridiculous timelines, but these timelines that just sound ridiculous?
Oh, that's a good question, yeah.
I do think it's very ambitious. So I've heard...
This podcast is ambitious. Ambitious but rubbish.
Yeah, so like the ones I've been hearing is, potentially a vaccine like end of this year, start of next year, and I'm thinking, how? Like, I mean, it probably is possible to produce a vaccine in a lab in small quantities in that time, but I don't see how you can do all of the trials and all the testing in that time, even if you run them in parallel. So if you're running all the, sort of animal trials, human trials, all the different stages, even if you're running that all in parallel, that seems it still seems ambitious.
I don't know if you can do that with the red tape. I don't think you can run them in parallel with the red tape. The amount of policy is insane. And a friend of mine who, I won't give his legal name away in case people are looking for it, but he works in Oxford and he is on the front lines of this. He's working in a big group there. The Oxford vaccine that you've read about in the paper?
Yeah.
He's basically working on that. And I asked him this, and the response I got was along the lines of, wow, the policy for vaccines isn't quite the same as policy for small molecules, but it's still humongous, and it's still such to me, insurmountable in the time scale that they've given.
Yeah, I mean, for context, I think, and I could be wrong about this, I mean, you guys tell me, I think the fastest we've ever developed a vaccine as a human race has been 5 years, I think.
So I don't know for certain, but that probably sounds about right. But I mean, but there is a difference between having a vaccine. We know it's safe, we know it's effective, it works. Here it is, we've got it. There's a difference between having, say, one lot of that in a test tube and having millions of them
Yeah.
mass produced and distributed and ready to go. Like that's quite a different ballpark. So it's. I mean, you could possibly have a vaccine produced that exists at the early part of next year, but having it so it can be packaged, so it's stable, easy to administer, and then distributed out. That's not going to happen.
That's an important point you raised there. Just so for our fine folk who don't quite fully understand what that means, can you just explain by what you mean by stable and compare that to a small molecule therapeutic like some ibuprofen that you bought last year that's still on the shelf?
Yeah, so I'll say something like your over-the-shelf ibuprofen. It's in like a little tablet. Usually, it's like film coated. It's very stable. It can handle hot, cold, various humidities. You can just throw it in the cupboard and forget about it. And if you take it in a year or two, it will still work. Whereas a lot of vaccines, they have to be temperature controlled. So some of them, you have to keep them between, say, 2 and 6 degrees Celsius. And even then, the shelf life might only be, say, 30 days. But even going before that, there's the fact that you have to actually mass produce it on a large scale. So, like, say, even producing anything in the lab, so small molecules or vaccines, like it's very easy to make it, say, just a small amount that you can have in the lab, just a few grams of the stuff. But scaling it up so you can churn out large volumes of it again and again and again, so you can give that to lots of people. That's a whole process in itself.
Absolutely, I would say as a chemist that it's easier to do it on a protein or a biological molecule than it is to a small molecule. But I'm sure if you use a biologist, you disagree and say it's the reverse. There's no easy way to go about it, and it requires serious R&D.
Yeah, I'd say both processes are very labor intensive, very tricky.
I got friends who work in both, and neither of them are happy about it. So there you are.
Yeah, that sounds about right.
So just as we kind of move forward, thank you for all that as well. It's some really insightful stuff. I think that was amazing. I just want to ask, do you think, because what you said, that you were very quiet the first couple of weeks, people weren't going to hospital, they weren't going to A&E, they weren't going for hospital, they were avoiding them, and rightly so. Do you think that we're going to see a backlog of deaths to come with non-diagnosed illnesses, diseases, and cancers that we could have got earlier and treated?
Oh, absolutely, definitely. Like there's no two ways of going about it. With GP practices being closed or say only doing virtual appointments, like just from our perspective in the lab, like it's fairly common. We'll get like routine blood tests in from a GP, and then we'll pick some up on the analyzer, and it's like, oh, that doesn't look quite right. We'll make a blood film, have a look, and it's like, oh my god, this patient's really ill. But whereas like outwardly they don't seem to be presenting with many symptoms, like say the GP is just sending us a blood sample because they're not too sure what's going on, they want to get more information, and then all of a sudden they go from being, oh, I don't feel quite right, I'll go see the GP, to within a couple of days they'll be seeing, say, a consultant hematologist telling them they've got cancer. And it's that sort of thing where if you catch it early on, it can be very treatable. But you see it sometimes where patients who, especially older people, where they've been ill for a while, so they haven't gone to see anyone. They've decided, oh, I'm just getting old. It's normal to be ill or whatever. So they leave it and leave it and leave it, and then by the time they turn up, they're in a pretty bad state. And by then, obviously, there's like that the outcomes are worse. So like the same thing's happening is going to happen with COVID-19, except instead of people like just not wanting to go to the doctor, they're going to be scared of catching the virus, so they're not going to go, or their appointment's been cancelled, or maybe they've just had, say, a virtual appointment where they've not had the opportunity to take any blood, and if they don't seem that ill from the outside, and that they probably think, oh, it's probably not that necessary to get them in to take some blood from them. So there'll be a lot of stuff which at the minute is going under the radar,
Yeah.
like it's not being detected, which obviously it'll just go on and on and on, and then patients will present with like much more advanced cases than they would have done.
Absolutely.
Oh no.
And then very quickly, so you've alluded that people will be, and this is an issue now as well. I don't want to fearmonger anymore, but in my opinion, I think that COVID-19 now, or some mutation of it, will always be present. I think in hospitals, and a bit like MRSA, just a little bit more difficult to get rid of. And I think we can get rid of it in our normal day-to-day lives, but in hospitals, is it going to be around forever?
I'd say that's possibly. I don't want to say likely, but it's definitely a scenario that we should probably keep an eye on. I mean, I've read a few things where, let's say, quite a few people reckon that the COVID-19 could end up following some sort of seasonal pattern in the future, where similar to what the flu does, where it flares up in the winter, then in the summer you don't hear much about it, not many people catch it, but then next winter cases start to rise again. So it could follow that sort of pattern. In terms of it becoming a hospital-acquired infection, say at the minute it's probably one of the biggest hospital-acquired infections, because a lot of the patients we see, they've probably, like, patients who were in the hospital already when the crisis started, like, they've probably caught it while in hospital. So from that point of view, I'd say it's quite likely it could end up becoming a fairly common hospital-acquired infection. But at this point, we just can't say. Like it could turn out that way. It might not. It's you really can't say.
Right. So you talk about the increased awareness from staff and from the general public, and obviously, last time we saw anything like this 100 years ago, or just over now, that we didn't have that kind of same connectivity that we've got. What we've seen is also a massive rise in bullshit articles and bullshit news. Have you seen any of these reports? Have you read any of them? Do you catch any of them as you're scrolling online? And where do you think they have stemmed from? And when did we, as a society, what happened?
That's a hard one to put your finger on it. I'd say it's good that we've got a lot of information out there, so like anyone can access a wealth of information about this. Which, say, 100 years ago with the 1918 flu pandemic, like the average people on the street, they didn't really know what was going on. They didn't know best practice, like of how to stop the spread, or like what to do, how to get treatment. Whereas now you can just go on Google. There's a whole wealth of information about this, but at the same time, there are a handful of, say,
Assholes. Call them what they are.
we'll go for that then. Like, arseholes out there who are trying to. I think that there are people who are trying to deliberately mislead people, either because they think it's funny or because they've got some sort of financial gain to get from it. But again, I think that equally there are people out there who are sort of like less educated on the topic. So people who aren't experts in the field, and then sort of purporting to be, oh, I know everything about this. I know exactly what's going on. This is what's going on. When actually, really, they sort of half understand the topic and have jumped to conclusions that, like, the evidence doesn't support. So then, they're being given the same platform as people who are genuine experts. And I think a lot of the time it can be hard to sort of distinguish. Like, when you've got them on an equal footing, it's, some professor with all his PhDs and, all his experience, and then just some bloke who watched a YouTube video, when they've more or less got the same voice and the same platform. Someone who is a genuine expert, they might not present themselves so confidently, or that they might not have like the natural gift of like oration, whereas somebody who's doesn't really know what they're on about, they might just be a really good speaker.
Well, we know what good speakers are capable of if we look back in history.
Exactly, yeah.
One more question, sorry. Sorry, my dogs were barking. So, I asked Lewis this question last time, and I'm kind of curious to see what you could say about this, Lyndon. The last time the world saw this or something to this scale was over 100 years ago with the 1918 Spanish flu pandemic. And like you said, before now we have so much information available that 100 years ago was not available. What other resources and tools do you think, at least from your line of work, do we have now compared to 100 years ago that could make the outcome of a COVID-19 pandemic much less devastating?
A major factor in the fact that this has been far less deadly than it was 100 years ago it's the way information can be exchanged. So not just between professionals, but between normal people. Sort of in academic circles, you can get genuine experts in the field can talk to each other instantaneously in real time. Whereas 100 years ago, you'd have to probably send a telegram, and that's a sort of awkward, clunky way of communicating, and it would probably take a lot longer to get the same amount of information across. Journal articles now, you just email them to each other. It's up there straight away. You can see it.
I think you get the same answer I gave when I was asked this last week.
Whereas 100 years ago, if you want somebody to read your latest journal, journal article you've just wrote, then you're going to have to send it to them in the post, and then they're going to have to like send a reply back. It's going to take days. Whereas now you can get an email in the morning, read it, type your thoughts upon it, email it back, and it can be done by the afternoon. Like things can progress much faster. People who get sick, get ill, they know exactly what's going on. They can see the latest government advice. So the government's saying, "Oh, stay home. If you've got these symptoms, don't go to hospital." Whereas 100 years ago, it would be, "Oh, if you've got these symptoms, you shouldn't come to the hospital." You'd have to, put up an advert in the newspaper, and then maybe somebody hadn't read it. Whereas now you're just bombarded with all these sort of, the government advice. Like that's a major difference, I'd say, as well as on top of sort of the obvious, sort of like the state of the field of medicine and pharmaceuticals is far more advanced now than it was 100 years ago, which makes it much easier to react to this new virus that's rising up. We know a lot more about the viruses and how they work, and we know a lot more about drug development and vaccine development, so we can do everything a lot more quickly. So, but I'd say that's a fairly obvious answer, that we've got a much deeper understanding of how viruses work and how the human body works than we did 100 years ago. But I think a much more sort of basic level, but very interesting way is just information, the way that we can communicate so fast now. So we can just sort of compile a lot of collective learning very fast. So we can just add to the pile of information incredibly quickly.
Yeah, I agree. Anything else you want to add, sweetie?
No, I think it comes down to what one of my favorite historians, says, which is, when the pressure is on, change takes off, right? And I think we live in a very unique time where we're going to see all of a sudden every single country being pressed with a situation, and we're going to see change happen really, really quickly, right? Thank you so much, Lyndon. It was so interesting to talk to you.
Yeah, thanks for having me.
Thank you. Is there anything you would like to add? Is there anything you've got to promote for yourself? Any books you've got written coming out? Anything at all you want to talk about?
No, I've not read any books yet, so yeah, I'm all right for now. So thanks for having me.
Well, thank you so much for the work that you do also.
Not a problem. No, thank you. That was amazing.
Cool, thanks.
All right, thank you very much. Once again, huge thank you to Lyndon for joining us. What a great conversation that was. A scientist who doesn't just lie for their own profit or gain. And
oh, well, the bar is so low after Judy, isn't it? Lyndon, you're so much better than that.
Oh, God, absolutely.
So, should we move on to the quick fire, not so quick fire round today?
No, we're going to be a quick fire, quick fire round today, because I said we don't apologise for length, but golly, it's getting long.
Absolutely. So for the quick fire round today, the first question is, and I hadn't even heard about this conspiracy theory, so you might have to explain a little bit. Did Disney cause the coronavirus?
You didn't hear this one?
No, I love Disney. I can't believe it's being blamed. It's like it's an amusement park. How can it be causing this?
So, according to Disney's Bob Iger, no, Disney didn't cause coronavirus. I can't believe you haven't heard this.
I really haven't.
So this was something that was going around whenever the fuck it was going around. And I don't know how it happened, but people said essentially Disney had started it in Disney Labs, because an animation conglomerate
Disney has labs?
Chemistry labs. And hang on, I'm trying to make sense of it myself. And that they are conversing in collusion with Bill Gates on a monetary return from the vaccine. That's the conspiracy, and I use the word conspiracy loosely because it's stupid opinions from stupid people, right?
That's so crazy. I mean, to even think, what kind of malicious plan would Disney, how would Disney even benefit from this? Or, as an amusement park, they'd have to shut down.
Do you know what? So when I was, I'm going to break the fourth wall and expose our business some more. When I was researching our tweet of the week, and I did try and look for some Disney-related gaga, someone had said exactly what you did. Why? How could Disney do this? Why would Disney do such a thing? This is not Disney. Disney is flowers and softness and child friendly, and they're the company you look at when how to handle a situation. Ask yourself, what does Disney do? Because they always do the right thing by the customer. And the top reply from some fucking idiot with an American flag in the background and the hashtag 2A shit. They killed Bambi's mother.
Oh, this is true though, and it was devastating for all of us who had to watch Bambi's mother die. But I mean, did Bob Iger actually had to go and had to like address this?
Yeah, you look it up. He had to come out and have a blanket statement. We don't know where this came from. We don't know what it does, but we're not involved, nor have we, and never will be involved.
That's so insane. I bet Bob Iger was like, God, this was not in the job description. Right? Things you never imagine yourself doing.
Is he the one with the book?
Which book?
Doesn't matter. Poor Bob Iger.
Absolutely. And, well, owing to time constraints, we'll have just one more, and I have heard about this one. It's also really crazy. How did Bill Gates know about this back about 2 years ago? He did a TED Talk on, the world not being ready for the next pandemic. Is this something he's created?
I'm having some weird deja vu again. Have we just spoke about this?
I think maybe we have.
So, Bill Gates did not know about this any sooner than anybody else ever knew about this. His TED Talk in whatever year it was, 15, 16. Coronavirus is a virus that we've known and we've studied for a long time, and this is a new strain of the same virus that we've been aware of. And his talk was basically alluding to the 2002-2003 scare that we had with SARS, because that's what COVID-19 is. It's a mutated form of SARS. He didn't know about this any sooner. He wasn't, giving away the secrets or saying, it's nothing. Of course, it's natural. I said when I was an undergraduate that the governments of the world, they are scared of a real influenza pandemic. And the reason why I said that was because I was looking at the 1918 pandemic. I was kind of looking at what I was learning in pharmaceutical science and thinking this virus really does not, it's not druggable, or it's very difficult to be druggable. And by that, I mean have a therapeutic. And the vaccines, yes, we have the flu vaccine, but it mutates so rapidly, it's quite hard to keep on top of. And I mean, I got it wrong and Bill Gates got it right. There you go.
Well, I think, part of the challenge with like I said, coronaviruses have been around for a long time and we've known about them. And Bill Gates and Melinda Gates do tons of work with other diseases that they've seen. So I'm not surprised that, he's involved in all this. Like, this is what their foundation does, and it's just unfortunate that this strain of coronavirus is so effective in spreading, because it doesn't just kill people left and right. If your hosts were dropping dead like flies, it wouldn't spread. But we have asymptomatic carriers, we have a pretty long incubation period, we have so many things that make it so spreadable and so virulent. So they do so much work, and I think the last time I checked, they have devoted $250 million to this COVID crisis, and they have been at this for a long time.
Yes, correct. It also does provide a massive tax relief.
Oh, God.
But that's for a different podcast, for a different audience.
Very different. But poor Bill Gates then, too.
Ah.
All right. So you guys know where to send us your questions if you've got any more. We would love to hear from you at buryingfakenews@gmail.com. And be sure to follow us on Twitter. At BF News on Instagram, or at Burying Fake News, Facebook, and YouTube. Please like and subscribe.
We live off likes and subscribes. Shall we launch into our final part of the show? I don't think we'll do Paper of the Week this week. Just, again, we're long and we're not sorry, but...
We're still trying to keep it together.
No, I never said that. That's not in my notes. It's long and we ain't sorry for shit.
Oh my gosh. All right, well, let's get to it, to the part of the show called Tweet of the Week. Play that funky music, white boy.
Oh, what a tune that was. This is the final and my personal favourite part of the show, and most hated, because I have to read this shit. Tweet of the Week. We read out the social media posts of people who actually wrote, believe, and Oh, they're committed to just spouting crap, so we're going to take the piss, as they say.
All right, I've got number 1 right here, and very relevant according to what we talked about today. It says, and I quote, according to the biomedical researcher and scientist Dr. Judy Mikovits, claims Fauci had the solution to stop HIV and AIDS, which he had a leading hand in, but let millions die instead. Now he is pushing for the COVID-19 hashtag vaccine with hashtag Bill Gates. Say no.
Say no.
Yeah, just a say no.
Say no.
This person clearly knows something we don't know.
Fauci, this immunology, leader of the immunology, the US, currently advising President Pigshit and his friends, had a leading hand in preventing HIV and AIDS, but let millions die instead. Say no.
Yeah, and I have to point out, the HIV/AIDS pandemic was very poorly handled, but I don't think Fauci was single-handedly responsible for it.
Was he? We can talk about HIV and the AIDS and how that was handled in a future episode, I'm sure.
That sounds good.
Post number 2. I think this was a Facebook one. I do vet these. These are real people. This is not a satirical account. None of these are satirical accounts or parodies. PhD biomedical research scientist, author of, and I'm not going to tell you what she wrote because I don't want to give her any publicity, detailing how Dr. Anthony Fauci sabotaged her research to cover up the true causes of cancer.
Oh God, I want to know what the true causes of cancer are.
I want to know how he sabotaged her research 2 years after she'd even started a PhD.
I know, like Fauci had a really... It sounds like Fauci was really busy during his academic years. Wow. Sabotaging things left and right.
Not only that, but the timeline makes no sense. Now, I will say this. If you're an American grad student, and I don't know why you're listening or why anyone else is listening other than, hi, Mum, is if they are batshit insane. Like, I remember a story of someone having to... all their experiments were failing and failing and failing. And in the end, they were confident it was something they were doing. They put a camera up. Someone else had come in and messed with their shit when they weren't there.
Oh, that's ridiculous.
As my favourite mentor said to me, quote, you have to be truly batshit insane to thrive or even participate in USA academia.
Oh, wow.
That said, Lewis, I think you... No, it doesn't stop there. They went on to say, that said, actually, Lewis, you do really well over there.
That's a really questionable compliment.
Take from that what you will.
Oh my gosh. All right. Well, the next tweet has got to be my hands down my favorite tweets here so far. And I think it'll be for this week. It says, quote, just a friendly reminder, Melinda Gates wears an upside down cross pendant. Wow.
Not only is that really fun, that was accompanied with a photo of Melinda Gates. Like it was cropped at her hemline, so if she was wearing something, I was never gonna see it.
I mean, it's so funny because Melinda Gates, I think she did her schooling with like nuns, or she had like a religious upbringing. She really did, and in her book, Moment of Lift, she recognizes this. And even if she did wear an upside down cross pendant, like, what's it to you, girl?
Look, we didn't. There was no conversation between us prior to recording about plugging someone else's book, but as it's Melinda Gates, I think I'll allow it. She's cool.
Oh, of course. She's amazing.
I'm just kidding. She's great. Number 4, quote, yes, obviously fake. I'm sure Trump knew all about the hashtag plandemic. It's confusing, though, because at first he said it was a hoax, but then he started to lie and say it was real. I guess even liars tell the truth sometimes.
Oh my God, that was so confusing. At first he said it was a hoax, and then he started to lie and say it's real.
Yeah, like when he said it was a hoax, it was the truth, and then he said it was real, and this guy's like, why is he lying? Even liars tell the truth sometimes. But that last bit doesn't even make sense with the first bit.
I was gonna say, so is he saying he's telling the truth or not? I don't even get this. I don't think this person knows what they're talking about.
No, because their entire account is dedicated to crap like this. A few of these might be from either stuff they retweeted or reblogged or whatever.
All right, so number 5. When are we all going to just tell this government to do one? No one can have sex with someone outside of their household? What the hell has that got to do with this coronabollocks? It's an exercise in control. There is no virus. It's a con. Wake up, idiot, or F off.
They did actually censor themselves.
Yes, and I'm not going to be swearing.
Could you just repeat the first line?
When are we all going to just tell this government to do one?
So you don't do one, it's to do one.
Okay, got this. The rest of the tweet still doesn't make any sense, though. Like, no one can have sex with someone outside of their household? Like, this is what the person's concerned about?
Incest. It's the solution. Like, you can't have sex within or outside of the household. Like, I've got to stick to my.
Yeah, I'm concerned that this is like the one thing that the person's like concerned about. This is where they draw the line. So, I don't know. Weird priorities.
There is no virus. It's a con. Wake
Yeah.
up, you idiots, or f off. Number 6. Number 6 was a reply to a government article about how to qualify or get access to testing, antibody testing. You forgot something important. Loss of credibility for lying to the public about a flu-like virus for imposing a fascist state.
Oh, wow.
Fascist state. You want to talk about fascist states? You go speak to Ava Kor about what a fascist state looks like. Fuck. You know who Ava Kor is, don't you?
Remind me again?
Ava Kor is one of the twins who was experimented on in Auschwitz, and I think she lost her sister during that, or well, let me say it properly, her sister was murdered by a fascist state.
Oh no, I mean, massages are essential, and if you deprive me of them, clearly I live in a fascist state compared to that. I'm being sarcastic, of course.
I was going to say, unless you are a fascist state, you're not a fascist state. It's disgraceful to compare anything to such that isn't.
Absolutely. This next one is another one of my favorites, I think. It's quite interesting. All right, number 7.
How many favourites have you got this week?
There's several that are pretty good this week, to be honest. Number 7, quote, "You are very believing of the official narrative. The actual odds of Prince Charles and Boris having were 25 million to 1. In other news, a unicorn is in my garden. Hashtag propaganda." So I'm guessing they were referring to having coronavirus, right? And I love this because while I guess, statistically you could kind of argue something along the lines like they completely, well,
You couldn't argue
it's
that.
I mean, they use numbers and everything, but you do realize Boris and Prince Charles meet a lot of the same people. Like, it would make sense that they both get it, right?
And they both meet a lot of different people from a lot of different places.
Yeah, of course. So I kind of liked how they kind of started out with like a very false number, and then it ended, it has the word unicorn in it. So, top tweet.
You just like it because it's got the word unicorn in it, don't lie.
Yeah. I love unicorns, and I can't believe coronavirus and unicorns were pretty much implied in the same tweet.
I think you might have to go over this because the number 8 is fun. Are you ready?
Mm-hmm.
In the magic land of Corona, the Covidian slaves did reside. Their phantasmagorical owner stripped them of reason and pride. Their lives became full of intrusion, accepted by them for a lie, infected by insane delusion that comatose slaves long deny.
Wow. I cannot believe someone actually took the time and effort to write this out.
Well, they wrote a poem out, didn't they?
Yeah, absolutely.
Fucking took all that time to write a poem. I'll give you a fucking poem. They should have wrote this. I'm a fucking moron, of which I have no excuse. When they put me together, a few nuts must have come loose. Now I tweet shit to pass away my time, dropping the word phantasmagorical into my little rhyme. I scream, I shriek, I yell, I cry, and Gucci eagerly awaits the day that I fucking die.
Oh my gosh. I guess people can come up with rhymes on the spot then. It's just me.
Yeah. Just you.
Just me.
Talk to us about number 9.
Yeah, number 9 is actually a reply to the above post, and it says, "I'm actually shaking. Just been to Leyland Garden Centre in Chorley, Lancaster. It's what's the most horrible shopping experience I've ever had. Rude staff shouting out orders, customers treated like lepers. It was truly unpleasant. When will this madness end?" Oh.
It was the most.
Yeah, basically. That's what she literally put. It's so sad that this person's, experience.
This was a Karen.
Yeah, definitely. This was a Karen, absolutely.
No, I saw the photo.
I mean, like,
I know this is.
Oh, you can confirm this was a Karen. Yeah, definitely sounds like a Karen. I mean, who else just thinks like, oh, my garden center experience was so bad.
They treated me like a leper.
I know.
What, they put you on an island and sent fucking Christians over to read the Bible to you?
Basically.
No, they didn't treat you like a leper. They treated you like social distancing, you fucking idiot. You're wrong. Joe, there's an account called, oh God, it's DHOTYA_, and it's Didn't Happen of the Year award. That didn't happen. That has to be a lie. Can't be real. But this woman was in the comments backing up the story. Literally shaking.
Yeah, no, I know. I mean, to be honest, I want to have this woman's life to, have this be like the worst experience
of
her
can
life.
You imagine? She must live a life of luxury.
Karen, we have other things going on.
I don't want to give away who she is, but her name's Wendy, by the way. Don't laugh. That's her name, Wendy.
No, it's not Karen, but it should be Wendy Karen.
Wendy Karen. So, as is usual fashion of Tweet of the Week, I like to end on a high. So this week's high is by Professor Carol Sikora, and what they tweeted out was the following, and I thought this was really important. It was tweeted out on June the 1st when Britain started to ease lockdown measures. Quote, "There are going to be a lot more vulnerable people out and about from today. Keeping your distance isn't important just for you, it's for them too. It's still best to work on the assumption you have the virus and you are desperate not to pass it on."
It's good. It highlights the importance of it's not just social distancing, it's physical distancing, but social solidarity.
And responsibility.
Absolutely.
Oh my God, I feel like we've recorded this episode about 4 times and done many takes.
I feel the same way too.
I feel like there's been a change of microphone. I feel like someone's got a new microphone that arrived halfway through this.
It's really good.
It's actually better than mine.
No regrets. Thank you, Amazon guy.
I feel like we've had computer crashes. I feel like there's been computer crashes. Off-topic chat.
Well, we're here to live and learn, right?
Oh God, and that kind of circles back to what I said at the very start. Please do support the people that if you follow a podcaster and they are on their independent sort of stuff and you really like what they do and you're genuinely behind them, reach out, buy a merch off them or go and support them for a few quid a month because it makes all the difference. I honestly, oh my God, the headaches. Before we leave, I must say thank you again to everyone who downloaded last week and to all our new listeners. If you're still with us and you haven't, as we said before, fallen into the jaws of infinity, you can reach us, send us your comments, send us your questions, any feedback, good or bad, we love to hear it. buryingfakenews@gmail.com, at BF News Podcast on Twitter, Burying Fake News on Facebook and Instagram.
Absolutely. Thank you guys for tuning in, and we'd love to hear from you. So please let us know through our social media, and we can have a good conversation about information and misinformation out there.
Can I go to bed? Say goodnight, Gracie.
Good night, Gracie.